Welcome, everybody. This is just a fantastic turnout for a very good cause for the Boulevard, so thank you so much for being here. I'm Tom Hansen, and I'm a co-chair with my wife, Nancy, who does all the work, and Robin Robinson, our MC. So just a couple of opening comments. You'll find on your tables 2 identical tent cards. On one side, you will see that there's a brief description of the Boulevard's mission, and you can scan the QR code if you want to learn more about the work of the Boulevard. On the other side, also a QR code, and that will bring you to today's program. And included in that program, since this is, after all, a fundraising event, will be the time at which we'll have a paddle raise. And there is a packet on your table, each of you, that have the numbers of your paddle and your name for your use for the paddle raise. And we hope that you will be able to do that if you haven't already donated, and support generously the work of the Boulevard. So I now turn it over to my co-chair, Nancy.
I'm Nancy, and I'm so glad to be here with all of you. You know, for 3 years with COVID, we had to do a virtual gala, and you all supported us tremendously through that. Now we can all be together today to celebrate the work of the Boulevard. And I'm so happy to be in this room and see so many familiar faces and so many new supporters of the Boulevard. Our third co-host is Robin Robinson. Come on up, Robin. You all may know Robin from her anchor time at Chicago Fox TV, and also a voice on WBBM. Robin's is no stranger to the Boulevard. She emceed the last two of our virtual events, and we are pleased to have her be able to co-host and also to MC this event today. So I'm going to turn the microphone over to Robin.
Thank you, Nancy, so much. Nancy is now a volunteer at the Boulevard, which means she's working like 4 times as hard. I worked nights for 40 years, so I'm always sending emails at 1, 2 o'clock in the morning. She was sending emails at 1, 2 o'clock in the morning, to which I was responding, go to bed, just go to bed. I'm so happy to see that there are real live people, because the last 2, how many of you tuned in to the virtual galas the last 2 years? I knew you were there. Even though when we were doing it, we were in a studio empty. It was a little difficult, but I felt that connection, that anybody who would tune in, who cared enough to tune in, you're my tribe. So I'm so pleased to be here with you today. The Boulevard does amazing work. They invite you to visit. But I don't think you're going to have to, because we're bringing it to you today. You know what the mission is, and there is a QR code. You know, we try to be a little techie, which leaves me lost a lot of times. But there's a QR code that can help you learn more about the Boulevard, because we're not going to take your time today giving you all the figures and stats and the numbers of people and the outcomes. We're going to let you feel that while we're here today. So beautiful room. Thank you to our staff. They're being so quiet, and you're going to be able to eat quietly as well, because we're not going to stop and then start the program. And we'll give you 5 minutes with no anything while you're eating, in case you want to eat loudly. So I would like to introduce to you, a great organization requires great leadership, right? And many of us have had experiences on boards. The board of directors of the Boulevard are a group of the most committed, innovative, be there when you need them folks that I have ever seen. Their leader is Christy Weimer. And Christy, yeah, you can clap for her. She's been a bigwig in banking for a long time, most recently and for a long time, the managing director, the control officer executive, commercial bank and oversight and control. That's a whole lot of control for J.P. Morgan Chase in Chicago. Alongside that, she has an active record of community service, working as a mentor for the Fellowship Initiative and as an executive sponsor of WIN, Women's Interactive Network in Chicago. She has a BS in Industrial Management from Purdue University and a doctorate in love. So please welcome our Chair of the Board of Directors, Christy Weimer.
Thank you, Robin. That was lovely, lovely. And I have some of my coworkers here that can attest. That's what I used to do, and they're happy I'm not there anymore. Anyway, but thank you so much for coming today. All of you are the lifeblood of what makes the Boulevard the Boulevard. Your support and your donations are all very important to our success and our sustainability. So today we're very honored to recognize one of those people that really made a huge difference at the Boulevard, Jennifer Nelson Seals. Jennifer. Jennifer's tireless dedication for over 27 years made us the organization that we are today. And 10 of those years, she was our CEO. And many of you have read our story over the last 2 years and know that we had a fire in a part of our building. And we were blessed to have the right donations to be able to rebuild one wing of our house in Garfield Park. So in honor of Jennifer and all the work that she did, we are dedicating our conference room to her in her name. We will have a more formal ceremony later at the house and unveil the room. Please watch our website for when that event is, and we would love to have you join us when that happens. Jennifer, thank you. You're the heart. Thank you very much. And with that, I'm going to pass to Richard, our CEO. Oh, sorry, we're going back to...
Yeah, we want to give him his proper introduction. You know, people go to school, get degrees, do all kinds of work. We want you to hear about it. You can read more about it, though, at that QR code. Joining at a very opportune time, last November, we got new leadership in the CEO seat. And then we said right away, and we need to plan a luncheon. So we gave him things to do. With a long, long history of experience in nonprofit leadership and in human services and housing development. Most recently, our CEO served as the executive director of Franciscan Outreach. Prior to that, he was the executive director of Northside Housing and Supportive Services. He's a Chicago native committed to serving our city's most vulnerable residents and making an impact toward not just mitigating, but ending homelessness in Chicago. He is right now, that's right, ending it. Let's go for the gusto. He's a member of the board of directors of the Chicago Continuum of Care. He worked to help create the city's original plan to end homelessness back in 2002 and Plan 2.0 in 2012. So please give a warm round of applause to the CEO of the Boulevard, Richard Ducatton-Zeller. How'd I do?
Thank you so much. Good afternoon. I want to thank you all for celebrating here with us today. As Robin mentioned, my name is Richard Ducatton-Zeller, and I'm the CEO here at the Boulevard of Chicago. I would like to first offer my sincere appreciation to all of you who generously made this event possible. I would also like to take a moment to thank Mayor Johnson as well as his team for stopping by earlier today to meet with some of our guests as well as our keynote speaker and some of our staff members. At this time, I would also like to extend a special welcome to several of our distinguished guests, and I ask that you please stand as I call your name. We have with us Christine Haley, our state homelessness chief. Chicago Department of Family and Support Services Commissioner Brandy Kanazi. Chicago Department of Public Health Commissioner Allison Arwadi. We have Chicago Department of Family and Support Services Managing Deputy Commissioner Mara McCauley. We have Dr. Carolyn Ross, CEO of All Chicago. We have Ryan Billeteri with the Chicago Department of Housing. And last, we have Meredith Moore, Chicago Recovery Plan Program Manager with the Chicago Department of Housing. We're so grateful that you are here celebrating with us today. So the Boulevard's Enhancing Lives Award was established to recognize extraordinary individuals and organizations making a significant contribution and enhancing the lives of people living in Chicago's underserved communities. This award has been created to acknowledge those who have made exceptional efforts to increase opportunities and eliminate disparities in the areas of health, education, employment, and housing. This recognition is also given to those who have demonstrated a strong commitment to diversity, equity, and inclusion. Today, I have the great privilege of presenting the Enhancing Lives Award to the Pierce Family Foundation. Founded in 2008, the Pierce Family Foundation has supported hundreds of nonprofit organizations like the Boulevard that provide essential social services and opportunities for people experiencing homelessness. The foundation has believed in providing unrestricted general operating grants and supporting real costs and real needs. I know that I can speak on behalf of every provider in this room in saying that we deeply appreciate that. The Pierce Family Foundation believes in offering help beyond the grant via numerous support programs and adopted a minimal application and reporting process. The foundation adopted its practice of trust-based philanthropy, which is composed of a concrete set of 6 grant-making practices that, when practiced together, contribute to a more just and equitable nonprofit sector. For the past 15 years, the Pierce Family Foundation has been a prominent voice in the push for greater investment in and innovation around capacity building and operational support for nonprofit organizations. The foundation's support for its own core grantee agencies has included a broad menu of programs and services beyond grant dollars, including ongoing consulting on IT needs, specialists available to assist with customized organizational development, the Top Talent Institute, which is a leadership training program, stipends for professional development, of which I personally benefited from, and advice and moral support through the ups and downs required to get a new agency or program off the ground. The foundation has also provided extra support to many of its partners experiencing a crisis, be it fire, server meltdown, boiler explosion, outdated bus, or other circumstances. And unfortunately, the Boulevard has experienced most, if not all, of these situations. And we are extremely grateful for the support. On July 7, 2021, we experienced a devastating fire which destroyed the east wing of our building. The Pierce Family Foundation answered our appeal for help and provided us with the extra capital support to help us rebuild. They have been a tremendous partner over the years, but more importantly, they have become a part of our family. So today, it is my privilege and honor to present this year's Enhancing Lives Award to Dennis and Martha Pierce, accepting on behalf of the Pierce Family Foundation.
Thank you. Overwhelming. And Richard, kind of took most of my comments, but I'm going to repeat them anyway. Great to see all of you here. This is really a spectacular event. The Boulevard is one of our, like Richard was saying, feel like we're part of the family. After the Pierce Family Foundation was officially incorporated in December 2007, the second grant we gave was to Interfaith House, now the Boulevard, wherein Pierce Family Foundation purchased this bus, which there's a picture that comes up occasionally, to help transport their residents to various appointments. That was in March of 2008. Over the past 15 years, we have been so proud to support the Boulevard, as it has provided support to nearly 6,000 people experiencing or at risk of homelessness. 6,000, that's amazing. We are honored to recognize this recognition, to accept it, and the Boulevard and other agencies who do so much important work in Chicago. May we all work to repair the problems that cause so much widespread homelessness in the first place. Personally, my wife and I, Martha, by the way, this is Martha and I, our 55th anniversary today. I'd like to thank Nancy and Tom Hansen in particular, who introduced us to the Boulevard almost 15 years ago, and have been loyal and great friends to participate in Boulevard events and others. Thanks to, in particular, the staff of the Boulevard, who likely saved our chief technologist, David Krumloff, who 10 years ago had a heart attack at the Boulevard Gala. It was, in fact, at the gala, which was up on the north side, and the ambulance came and rushed him to Northwestern Hospital, and literally his heart stopped in the emergency room, and it was restarted. So, my wife Martha and I, whose own experience with nonprofits inspired the type of support that Pierce Family Foundation has given to various agencies. It really started with Martha's group at that time. She was the executive director of a group called the Chicago Metropolitan Sanctuary Alliance. And they struggled with communication, computer problems, bookkeeping, and whatever. And Pierce Family Foundation took that group, along with a few others, including the Boulevard, under the wing to give them assistance, back office assistance, and help build their capacity to actually perform their mission. This set a model, and for 15 years we have followed that model. We think it's a good model for the foundations to help the actual operations of these different service providers. The Pierce family staff and consultants who have provided so much expertise and experience to the Boulevard and others over the year, I'd like to thank them. David Krumloff, our chief technologist, one of our two co-executive directors, Heather Parrish, is with us today, and I think Mary Ann Philbin is someplace. I'm not sure where Mary Ann is. Anyway, Laura Jensen, who is our right now director of program and management, I believe it is. Chris Torkelson, who has helped a lot of groups in many ways as a consultant. Lindsay Marriott, one of our very first executive directors, and my assistant from many years, Pam Stillwell. Also like to thank Pete and Joan Villum, who have been our grant-making partners for the last several years. This is a new model as well. Pete Villum came to me and said, let's work together. I said, great idea. Let's share our staff and each foundation benefit by that. And Richard has gone through a number of different activities that we have worked with other foundations as collaboration partners to make the build up different events and processes, programs, whatever. In any event, thank you once again. Enjoy your luncheon.
Thank you very much, Dennis Pierce from the Pierce Family Foundation. As I'm listening, I'm thinking, who gives to that? You know, if you ask somebody, could you give us some money for our back-of-the-house activities, payroll and computer software? It just doesn't quite touch. So having a foundation that is focused on that so that the organizations that are doing the work can do it for as many people and in the best way possible. That's very innovative. It's a great model, and thank you for your support over the years. It's just the room full of people that care is amazing. We mentioned, I try not to get into the list of VIPs. That Mayor Brandon Johnson, who was here earlier, we just asked him not to stay because he's a distraction. Everybody wants a picture. Actually, his schedule wouldn't permit him to come to this part, but he could come to the reception. And he's got his top people here supporting us, not just today, but in all the things that these organizations do to end homelessness. We also have, and probably they didn't know, we have the largest provider of shelter beds and homelessness prevention services in the region is the Primo Center. So can I get Shelley Cooper to stand up from the Primo Center? You don't have to stand up, just I want to acknowledge you. Wave your hand. All right. But everybody in this room is a VIP. You're doing very important work, and you've been eating so nicely and quietly that I'm going to give you 5 minutes to just go for the gusto. We'll be right back.
Guest speaker today, who I consider the father of medical respite care. As you know, the Boulevard is a medical respite center, and Jim O'Connell has a great connection to that. And he's going to tell you a little bit about it. And we want to welcome him. He's come all the way from Boston to bring the news. In your program, you'll read his official biography, and he's got a lot of very major accomplishments. But that biography of his accomplishments and his honors doesn't quite capture who Jim really is. Jim is a pioneer of medical respite care. He's a compassionate caregiver, and he's a dedicated doctor of street medicine. Those are the words that I think really captures who Jim is. Jim has been on a crusade to care for the homeless on the streets of Boston for almost 30 years. And he's still riding a van at night during the week to care for those who are living in doorways and in tents. This is a special guy. Almost 30 years ago, when Interfaith House, now called the Boulevard, was only a dream, we turned to Jim and his colleagues at the Boston Healthcare for the Homeless for guidance. They had started the first medical respite center in the whole country. And with his help, Interfaith House, the Boulevard, was born and became the third medical respite center in the country. Jim's come from Boston to inspire us today with his journey and his passion for providing healing to the homeless. It's my privilege to turn over the program to Dr. Jim O'Connell, president of the Boston Healthcare for the Homeless, my good friend and distinguished leader in the medical respite movement. Jim?
Hey, good afternoon, everyone. I'm cheating here because I have 12 minutes, and I'm going to make sure I don't go beyond that. So, first of all, I'm overwhelmed to be in such a beautiful facility, and thank you all for coming out at lunchtime for this. I am here because, one, I love the idea and the concept of medical respite care. Two, for 25 years, I have loved, admired, and in many ways emulated what you are doing here at the Boulevard with respite care. And the third one is I've never learned how to say no to either Nancy or Tom Hansen, so I'm here. But just to give you a little, so, thank you for calling me the father and not the grandfather of respite care, because I kind of like, I'm hanging on to that little thing. But, so many things go through my mind when I think of this, because homelessness, as you all know, is so complicated. And we all have to get together and come up with different approaches to the solutions. We all know that we absolutely need housing to scale. And then we need to make sure we have the support for the people that go into housing so that they are successful. And most of what I've learned, I have to say, I learned from the nurses back in the shelter a long time ago. And I learned from the people, the homeless people themselves who were involved in putting our program together, and many of whom are on our board of directors. And they had several things they insisted upon when they wanted a healthcare system set up, as we were trying to do in Boston back in, this is almost 40 years ago now, 1985. And it was 84 when they were talking about this. So what they wanted was continuity of care. They wanted no more charity. They wanted to have social justice, to have health care provided the same way all of us expect health care. They didn't want us to be there one night and not there when they're sick 2 days later. They wanted consistency. And among the many other things they said, they had a legal document that they made the mayor of Boston sign, since the grant was from the Robert Johnson Foundation was being given to the mayor. And in it they said, you have to come up with a medical respite program. And none of us had ever heard of anything like that. And what they meant, and I think it's important because knowing what respite care is kind of critical to all this, is they were incensed and particularly angry at us doctors for taking care of people in the hospital, but then as soon as they're almost well, we send them out, and they go out to the streets, they go out to the shelters, but they can't go home where they have families to take care of them and a visiting nurse and a home health aide and all the things you need for healing. So they insisted that we have this thing called a respite program. And so we were given by Governor Dukakis back in 1985 these 25 beds in the corner of a shelter, and they said, you got to take care of people 24 hours a day for stuff. And so we learned by the seat of our pants, always checking in with the homeless people we were serving. And that became, at the same time, there was also a program in Washington, D.C. called Christ House, which is another phenomenal facility where there are people that have been, a respite program that's been going since then. And for the longest time, that was it, because there's no acknowledgement by our system that you need that kind of care for people who don't have safe places to live. And we thought of, what is respite care? And think of this. So if you don't have a home and you're out wandering around, you're in the shelters, and you have to go into the hospital for anything, you name the illness. We used to keep you in the hospital a long time. Now it's a very short period of time and we kick you right out. And then you have to wander, I'll give you the example I shared yesterday when I had this wonderful discussion with Dr. Carolyn Ross, who's over here somewhere at the Boulevard, is that, think of it, we used to keep people in the hospital for about 6 weeks when you had open heart surgery. 6 weeks when I was a resident, okay? Now it's about 3 days, okay? And most surgery, cataract surgery, which you're going to hear something about, hernias, things like that, most of that is outpatient surgery. And what happened is we started to learn that respite care was really had to fill in these gaps. So who gets somebody to their surgery, picks them up after their day surgery. So, and the other thing is if you had cancer and you needed chemotherapy, we used to admit you to the hospital. You got your infusion of chemotherapy and we kept you there for a week until you were safe enough to go out. Now that's all outpatient. So you can imagine what it's like to have no money in the world, no place to leave your stuff, walking outside, and having lived through all of the, the trauma and everything else that our homeless folks go through, and no place to recover. So what is respite care and what does Boulevard do? It fills in that absolutely critical gap in our system. And it becomes this hugely supportive program for people who need a place to heal, a place to get their lives together. And that doesn't exist in our healthcare system. So it has to be done by people like you supporting a place like Boulevard. So as I step back, I think I've got all these years of going, and I had 25 years ago, I had a chance when I got this call from Nancy and Tom to come and see what at the time was a relatively new respite program here in Chicago, and it blew our minds. It was this phenomenal place where people were coming, getting all sorts of social support and eventually medical support, but then many of them were just moving on into housing. It became that really critical step into housing. And as I've now looked more and more, I spent this wonderful afternoon yesterday with Richard and his staff and with Dr. Ross, learning about exactly what goes on. And when you walk into, if you haven't been there, when you walk into Boulevard, the first thing that comes to my mind is there's a group of people there that are just letting you know you are worth it, that you are someone. And you can just see that from everywhere, from down in the, in the cafeteria where we were to up in all the rooms. So it's a place of welcoming, of healing, and if I dare say, it's a place of real love, where the kind of love that most of our folks haven't had. And let me, I worry to death about how much time I have, but when I think now about what you have been able to accomplish here, which is unlike almost any place in the country, so please acknowledge what a gift you have here, what a joy it is to have Boulevard. And I guess I'm trying to say, and please don't let it die. Help it go to the next level of whatever it can be. Because many of us outside the world are looking and see how you're doing. And then, let me just tell you a story of what we've also learned about respite care is that, so people when they're outside need a lot of care when they're hurting. But we're now trying to get people into housing, and I've been listening to many of the remarkable housing programs that you have. I've learned from All Chicago yesterday, and then I'm sitting at the table with the housing opportunities for women folks, and you're doing remarkable stuff. And we know that nothing is going to get solved until we can figure out how to get that housing. But just remember, once in housing, and as we've learned, you can be isolated and alone in a scattered site somewhere, away from the neighborhood and when you get sick, there's no one to take care of you. So what does the Boulevard become, what of our respite programs become? A supportive housing service. So if you're getting chemotherapy and you now have your housing, you can come over and be cared for to get through those really tough days. If you've just had surgery, you can be cared for. So I think one of the key things, supportive services, when we talk about supportive housing, is please acknowledge that, or please understand that places like the Boulevard need to be all over the country. They need to be where people can be cared for. So I really salute you for all that you're doing. I have to acknowledge, where's Jennifer over there, somewhere in there? Because I knew Jennifer for years, but thank you for doing that. And now I listened to Richard yesterday, and you have passed it off into really remarkably good hands. So I'm so excited to be here. I can't tell you, what a treat it has been to watch. I'm also, I have to admit, a closet Chicago fan. Having gone to school down the road in South Bend, that this was the only culture I could find back then. So I am phenomenally devoted to all of you for providing a city like this. But so as a final thing, I just want to say, please, anything you can do to support Boulevard, I promise you, it's something that is unique in the world, and it's something which really needs to be expanded and duplicated and offered as a support to people that we know are desperately needed. And I know the most important thing to hear are the stories of the people who have been through that. And I know after me, you're going to hear a story that will make you forget anything I've said. And what it reminds me of is the courage. One thing we learned when we're outside, and I've been doing this, it's almost 40 years now, so 38 years, that my first impressions of people when they're living outside and they are invariably wrong. And as you have a chance to get to know them over time, you start to realize no one is there because they want to be there or have chosen to be there. Everybody has lived through some version of their own hell. And what they've grown up with, think of it, 25% of the folks we care for on the streets of Boston cannot read or write. So the problem happened many years ago in poor schools, neighborhoods full of racism and poverty, lots of violence, and homes that were broken. They grew up in foster homes, and they suffered unspeakable trauma. So we start to realize as you hear those stories, these are people that are living with incredible resilience and incredible courage, and in fact, are true heroes. And you're going to hear from one of them now. But I just wanted to say in final, thank you so much for letting me, be here to get away from Boston. By the way, you can't see the water at Boston right now with the haze, so it's great to look out and see the water. But please come and see us sometime, because we have another version of the socks, and we'd love to show you that part, okay? But thank you very much.
Thank you, Dr. Jim. We'll just leave it at you're a Sox fan. Let's leave it right there. And I'm speaking of the smoke on the Eastern Seaboard, that's my best analogy for why you should care about something that doesn't seem to be impacting you at the moment. If there's a fire over there that you didn't bother to prevent or help put out, the smoke will eventually cloud your world. So I'm really pleased that you all are the people who know that. Just spread the word. I would like to introduce you now to a gentleman that I recently met that I think I'm in love with. He is just a living example of how adversity really can be opportunity. So please give your full attention and a warm welcome to Daryl Ferguson.
Thank you so much. Wow. I salute everybody. My name is Daryl Ferguson, and I first of all just want to thank everybody for being here today. And believe it or not, I take it very selfishly as if you came just for me. But I know that you came for many others like me. And not only do I speak for myself, but I speak for them too. I want to just take you back and share 1 year of my life with you. And the life-changing, is my time over? The life-changing experience that I had and very much I'm still having at the Boulevard. Believe it or not, it's an address that I'll never forget. It's my home, 3456 West Franklin Boulevard in Chicago, Illinois, 60624. That has become my home. Last year, in 2022, I celebrated my 55th birthday. And shortly after that, March of 2022, ladies and gentlemen, I was completely blind. I came down with what the doctors call a very severe, rare, acute case of cataract. I've often heard of cataract, but men is men. I just thought that it was something that I would just easily overcome. I navigated myself around the streets of Chicago. How was I able to navigate myself around the streets of Chicago? Because I was homeless. I knew the streets of Chicago. But when I got tired and I got withered, hope was gone. I heard about a program out south. I won't say the name. I navigated myself to that program, and this is what they told me. They said, you have Medicaid insurance. We're going to give you 30 days, and then you'll be released from here. And I said, where would I go? They said, we don't know. They said, we don't know. Ladies and gentlemen, my second week there, I went to see my case manager, my second week there, which I was supposed to see him the next day. Thank God for the Boulevard. And my case manager told me that he was going to call the American Blind Association, the first light of hope that I got. But when I spoke to them on the telephone, they told me that I had a 4 to 5 month waiting list before I can get in. You see my dilemma? You see the intervention now? So here it is. I got 13 days left in this program before I'm released, and I don't have anywhere to go. Now, it's plenty of shelters in Chicago. Let me tell you something. If I haven't been there, I work there. Saddest to say, I felt safer on the street. They promised me something, and they gave it to me because in those 13 days, you know what they told me? They said, it's time to go. I navigated myself through that building. I packed my bags. And I said, listen, I heard about a place called the Boulevard. I said, could I just call them? Wasn't much hospitality there, but they allowed me to call them. 20, 30 minutes later, they say, well, you don't have a call back. What are you going to do? Well, you don't want us to drop you off at. a case manager ran out the office and said, the Boulevard is on the phone, and they want to speak to you. I told them my situation, and they told me that I can come. I didn't know what I was going to expect. I have a lot of knowledge of many shelters in Chicago, but I never had a knowledge of a medical respite. It's different. When I got there and found myself in the foyer, the intake personnel told me that I had a lot of papers to sign. You see my dilemma? I can't see. She came back in 20 minutes. She said, you haven't signed any papers. I said, could you help me? I can't see. And I can feel her compassion. I can feel her concern. And she said, wait a minute. She ran off, and she came back in 2 or 3 minutes. She said, I'm going to help you sign these papers. I was accepted into the Boulevard. And since I've been in the Boulevard, I've received what's called radical hospitality. Radical hospitality and love and accountability. And I'm just talking about from the medical team, the PCT, which are marvelous, because I was told that my first operation would be 11 to 13 months away. The medical team at the Boulevard said no. They started making phone calls. And within 3 to 4 months, I was on the operating table, and I received one of my eyes back. Now, if that ain't hope, I don't know what hope is. If that ain't hope, I don't know what hope is. When I received, I know I don't have enough time. When I received the one eye, immediately I wanted to become someone that helps someone, because I had been, listen, I was asked a question just yesterday. It said, if you would credit your transformation to a person or a thing in the Boulevard, what or who would it be? There's no way I would be able to do it. Everybody from the medical team, the maintenance team, the dietary team, listen, created a clean and safe environment for me to heal in with no threats at all. I don't just act better. I don't just feel better. I don't just know better. Ladies and gentlemen, because of you, I am better. I am better. I am better. Thank you very much for allowing me to share my story with you. Thank you.
I told you guys. Nothing says it better than the actual outcome. Daryl told me, he said the best thing happened maybe that I went blind, because it does connect people to other things, not just an ability to heal there. And you know, it's not easy taking care of sick people. When my daughter got COVID, I wanted to send her for respite. Okay, because it's like, I can't do this. There were way too many demands. But you see what they do, and you see how they do it. And I would not have done this, but Nancy's husband, Tom, warned you earlier that we were going to have a paddle race. You don't let people know ahead of time there's going to be a shakedown. But there is. So based on what you heard, we know you're already supportive, and we know that you will do what you can. And we are trying to get out of here in just the next few minutes. So the quicker you bid, the faster we can leave, right? So I would appreciate it if you all would do what you can in our paddle race. Everybody have a paddle? Can I see everybody's paddle? I just want to see it. I'm not going to have you buy anything. Just hold it up for me. Just hold it. Somebody should take a picture of this and we'll say, look, everybody gave. So I would like to start with what will cover the costs of setting up a new home for one person moving into permanent housing. And imagine what a celebration that is. But you need a lot of stuff. Have you moved lately? Furniture, kitchenware, appliances, bedding, linens. You got help with those utilities. You got to have a security deposit. That's about $5,000. So I would like to start the bidding. If you raise your paddle, I'll call your number and give you Daryl's thanks for $5,000. Anybody will do 5,000? 171, 116, 115, 155. Got light in my eyes. 169. That's why I keep looking. Thank you. Anybody else at 5,000? Yes, give them a hand. If you're not bidding, you're clapping. Did I get somebody else? 183. Is that right? Because even with glasses, can't quite see to the door. All right, that's the $5,000. Thank you very much. That was super generous. For $2,500, the Boulevard can provide a month of medical respite care for a resident. Sometimes they only need a month, right? Thinking about, depending on what it is, a month. That changes a life. For $2,500. I have any bids for $2,500? I have 188, 185, 120, 237. Come on, 2,500 going once. Thank you very much. Y'all are super generous. Six months of group therapy counseling. Talk about life-changing. I think I might want to go join them. $1,000 for 6 months. That means that we are really being very efficient. Group therapy, $1,000. 124, 147, 226. Thank you. 356. Appreciate you. Hi. That's my. Sorry. Anyway, 205, 197, 175, 172, 188, 202, 187, 194, 130. Thank you, 179, and 182. I will swing back. 240. If you're still thinking about it, 250. I like that. That 1,000 is kind of a nice round number, kind of the price of a designer purse. Pair of Louboutins that I don't wear anymore. All right. Very nice. Thank you. Give yourselves a hand. We love that. And you all are going fast. I like that. All of our residents can get fed for a whole day for $500. 3 nutritious meals a day. Daryl cut his remarks down a bit, but he was raving to me about how good the food was at the Boulevard. So $250. I'm sorry, $500. I'm not to $250 yet, so hold that. $500. Can I get it? Oh, I got it. 192, 206, 210. Thank you, 211. Thank you, 215. He's got 2. I love that. 225 and 224. It's like the double-fisted drinker. 148, 274. 104, 272, 239, 238, 145, 124, 129, 131. Circling back. Thank you. That those $500 donations. You go on for a job interview, you got to have the right thing to wear. You got to have the right footwear. Some new clothes, some shoes, transportation to get there. You know, they prep you, but you gotta look the part. So for $250, we can do that. Really nice, low, easy number. Let's go. 266, 195, 315, 199, 200. Thank you. 195. Thank you. 174, 322. Thank you. 117, right here in the front. 163, 184. 156. 234. Thank you. 233. 348, appreciate you, 232, 125. The sun is getting me. 256, 258, 255, 133, 260, 269. I feel like I've got a ship or something, but okay. Thank you very much. Basic needs, all the things we pulled out of our medicine cabinet today, the deodorant, the lotion, the toothbrush, the toothpaste, all that. I had a lot more stuff than that, just want you to know. But basic needs for personal hygiene, $100. It's a nice even number. Thank you. I'm 189, thank you. 323, thank you. 316, thank you. 175, thank you. 166, 213, 310, thank you all. 157, 160, 219, 292, 289, 293, 218, 235, 103, 283, 228, 235, I got you. 282, 231, 203, 158. Thank you, guys. 150, 147. I'm not tired. 268, 277, 230, 262, 144. Nobody gets tired counting their money. 285, 286, 276, 122, 123, 152. Okay. Thank you very yes. Very nice. This is a level that I suggested. We know that everybody's really generous here, but you really don't know where people are at. So we wanted to go to a level that just about anybody, even my broke kids, could bid on, all right? So a donation, this is so important, of $50 can cover the cost of an ID and a Social Security card. You know, sometimes it's complicated. It's not necessarily the fees, it's the bureaucracy. And you know, what do you have to support that? You got a birth certificate. Has someone stolen your identity? So it's the Boulevard staff puts that time in, but there are fees associated with $50. They can get a Social Security card, a birth certificate, other necessary items without which you just can't move forward. So I will read off as many numbers as I have to. Got no problem with that. So do I have any $50 bids? 175, 112, 163, 114, 167, thank you, 308, 312. And y'all gave a lot earlier, so you don't have to give that. 280, thank you. 320, because you start thinking, shoot, you had $50 to park. Give yourselves a hand. You are an amazing and generous audience. I want you to know that though we are trying to get you out of here in a hurry, just in case you have to go back to work or to Zoom or whatever you're going to do, or I'm going across the street and wait for the Blues Fest to start. It begins tonight. Dr. Jim has an amazing book called Rough Sleepers. It was on the New York Times bestseller list. He didn't write it. In fact, he says he didn't even know how it was going to turn out till he read it. And it's a story. It's a quick read. You can read it in a day. He will sign and sell you a copy and have a conversation with you. He is the most generous man with his time, and he has spent most of it on people who haven't had much generosity. So please take this chance to meet this iconic founder, really, of the whole concept of medical respite. And as promised, I have two winners of the raffle, but I left it over here. I'll be right back. So, award-winning artisan goat cheese gift basket. I don't know how I didn't win that, but it's Bob Urso, bidder number 192. And wired on Waverly original handcrafted jewelry is going to, the next time you see her, be on Sarah Cancella, bidder number 334. Oh, I can't see it either. I can't either. Well, everybody else can see it, so we don't have to see it. 283,758. How is there an 8 in there? All those were, anyway, doesn't matter. I'm not going to complain. Math was not my thing. Thank you. That is amazing. We appreciate you. And they can drink till 2 o'clock, but have a designated driver. You guys, you've been amazing. It's been my pleasure to be here with you in person after 2 years virtual, and hopefully we'll see you again next year. What?